I started out training. My pre-medical years were at Princeton, and that's where you take the courses necessary to go to medical school. And those were finished there in 1971. So after I left there, I went to Mount Sinai, which is a medical school in New York City. And after completing my medical training there, I went on to train as a psychiatrist at Yale University in New Haven. And when I finished training at Yale, I moved out to Santa Fe. During my medical training, I'd worked at the Indian Hospital here, and my wife and I fell in love with it, and we decided to raise our family here. So in 1978, we moved here from the East, and this is where we've lived ever since. I've had a close relationship with prescribing psychologists since the beginning of this program back in the early 2000s. Our bill for allowing psychologists to prescribe here in New Mexico was 2002, and it started in 2003. At some point, I was involved in the course training, like for prescriptive abilities for special groups, pediatrics, geriatrics, for example. And I gave courses in the training before the official program was taken over by New Mexico State University, which is in Las Cruces. So I got to meet quite a few, dozens at that point, to find out their level of education, dedication, and I was very impressed with how much energy and sophistication they really brought to the field of prescriptive psychology, which is an additional icing on the cake of the general training that they've had. So after that, I actually became the physician member of the state board in New Mexico. So I had the opportunity to evaluate the credentials and applications of everyone who had applied as a psychologist for prescriptive authority here in New Mexico. And over the course of this last decade and a half, I've really had a chance to see what has come of the initial idea that psychologists might be able to be effective prescribers of psychotropic medication. In addition to officially working for giving licensure, I've had the opportunity to watch psychologists go from the training stage to the actual stage of clinical practice. So they've gone from the stage of being trainees to actually being colleagues. So I've had the chance to work with at least a dozen of them over the years around the question of the best way to approach patients and which points medicines would be helpful to be prescribed, or often the case, not prescribed. One of the problems that people have in the field of psychotropic medicine is that many people who need it don't get it, but many people who don't need it have it prescribed. And it's a paradox. But one of the things that I'm really pleased about the training for the psychologists for prescriptive authority in New Mexico is that they work very hard about that difference, because the prescriptive authority to be able to prescribe medicine also gives the authority not to give it when it's not indicated. So when the opportunity arose in New Mexico, and working with some of my psychologist colleagues in town who entered the program for prescriptive authority, I first met with other doctors and psychiatrists and psychologists that were central to this training program. That's how I first got involved with the program. You know, at first, to be honest, as a physician and as a psychiatrist, I also had my doubts as to how such a program might be organized. But when I saw the curriculum and I saw how thorough it was, I saw how many bases it covered, and I saw the level and quality of the psychologists who became interested in the program, my fears were relieved, and I became a part of it. So that when the time came to actually put the law into effect, one of the requirements of the board that oversaw giving out the licenses for prescriptive authority to psychologists was that there be a physician member, and I was asked by the governor to be that physician. So I've had the chance to oversee the process, both in terms of training and as a clinician, where I spend 95% of my time, and finally as a volunteer on the state board. You know, when I think about the kind of training that the psychologists have gotten here in New Mexico, two factors that stand out. One is that the training is extremely thorough, that the psychologists are quite capable on their own of caring for their patients in every dimension, psychologically, but also biologically when medication is indicated. But the second factor that stands out to me when people criticize the training is the isolative fantasy they have about psychologists. The psychologists in New Mexico are team players. They're part of an overall team that provides care for the patients in New Mexico. They work closely with doctors, with psychiatrists, with social workers. They make the care the best possible care that the patients can get. You know, to those skeptics, I would say, let's look at our experience in New Mexico. In New Mexico, since people started prescribing, and those people being psychologists started prescribing, there have been no difficulties in terms of complaints of unsafe practices. Now, I'm on the board. I can tell you there have been none. Now, I'm not saying there have been one or two, but it's been taken care of it, or it's been a minority, or it's not been much of a problem. I'm not saying any of that. I'm saying none. I'm saying none as in zero. So to those critics, I would say, listen, I understand theoretically what your concerns might be, but actually, that's not a problem. Another factor which I think is very important to understand, and this relates to something that we were talking about before, is psychologists work as part of a team. For example, one of the side effects certain medications might have might affect the heart, and the vulnerable state of a person's heart might affect the choice of medication. The psychologists who are trained in the program are very aware of that, and they work with the internist and cardiologist involved before the medication is prescribed. What I'm always concerned about when objections are raised to psychologists' ability to work with complex medical problems is this. Psychiatrists don't work with complex medical problems. They're part of an integrated team of specialists. My license as a psychiatrist from the state of New Mexico says I'm a physician and surgeon. But I can tell you it's been years since I had anything to do with taking out an appendix. And that hasn't happened since medical school. So of course I work with other specialties, cardiologists, endocrinologists, to deal with the best possible treatment for the patient. Psychologists do the same. If anything, psychologists are especially and acutely aware of the differentiation between psychology and psychotropic medication and the interface of the use of that medication with other medical specialties. One of the factors that I think is very important to realize here is that every study of the prescription of psychotropic medication has indicated overwhelmingly that the majority of these medications are not prescribed by psychiatrists, but rather by doctors in other medical specialties, usually frontline doctors, internal medicine, family practice. These are very busy and overworked doctors. These doctors have been using psychologists as consultants in New Mexico even before the law was passed. They've asked for their opinion as to what's diagnostically going on with the patient and even what medications might help. And then the doctors in their busy practices have to write the prescriptions. These doctors have confided in me over the years that they are pleased that psychologists have prescriptive authority because when they make the referral, not only do they know that their patient gets good psychological care, but that their psychotropic medication will be managed by someone who understands the subtleties of the psychological changes that occur when the medicine is prescribed. You know, when I think about the role that psychologists in New Mexico have played since there has been prescriptive authority, there's really, in addition to the high quality of care that psychologists give, there has been an increased availability of evaluation and treatment when it has been needed that wasn't available prior to this prescriptive authority in New Mexico. You know, even in Santa Fe and Albuquerque, which are the two large population centers which have a high number of psychiatrists, it was very difficult to get an appointment and almost impossible for someone to take on medication maintenance kinds of psychotropic treatment. And psychologists not only treat and evaluate those patients, but have shortened the waiting time to see a prescriber and have given prescriptions that would otherwise be unavailable. You know, when you think about safety issues for prescribing, it's possible to conjure up imaginary scenarios like a psychologist acting on their own, treating a patient with medical problems that somehow they would be unaware of and wouldn't know how to treat. Now, this imaginary scenario has never happened in New Mexico. But even if you thought this imaginary scenario might be a reality, I would ask you, how many thousands of people do you want to go untreated because they can't get an appointment with a competent practitioner to evaluate their situation, to relieve their depression, to relieve the incipient psychosis that would not otherwise be treated? How many of those people do you want to go on suffering just because there's an imaginary person somewhere that might have had been misdiagnosed and mistreated? So in order to close the gap, we need to have many more qualified practitioners. Psychiatrists that were afraid psychologists were going to take away their business have discovered, much to their pleasant surprise, that they're busier than ever, and that the fact of the matter is you still have trouble getting an appointment in a timely fashion with a psychiatrist in New Mexico. In the rural areas of New Mexico, the problem is enormous. And it is those areas where the prescriptive authority for psychologists hasn't merely been helpful, it's been essential. And literally every year, hundreds and hundreds of people that would have gone without treatment because we could not close the gap between need and the services provided are now getting those services. You know, just on a very human level, you should know that the patients in New Mexico are very appreciative of the fact that their psychologist had gotten prescriptive authority and can prescribe for them. I've had the opportunity to consult by way of second opinions and by way of other family members that I've referred, like the spouse of or the child of, to a psychologist. And what I hear again and again is that the same caring psychologist that does the psychotherapy, that does the psych testing, and that when the need came for medication, when they were able to prescribe it, offered the family a tremendous amount of relief. The real answer is the continuity of care is both simplified and made more effective when the person doing the diagnosing, doing the psychotherapy, can in fact also prescribe the medication. Every psychiatrist knows that that's true. And I'm quite confident that any general practitioner who's uncomfortable with the level of their diagnostic acumen for a specific mental illness would be very pleased if the psychologist who was able to make that diagnosis had the training and ability to then prescribe the appropriate medication. I think 15 years ago might have been a theoretical question. But today in New Mexico, it's very clear that that has been answered empirically. It is a safe practitioner who's a psychologist trained with prescriptive authority for psychotropic medication to be a practitioner in the field working as part of a team providing mental health to the state. And there is no evidence, none, zero to the contrary. There hasn't been one complaint, not one, not just a minority, not just one or two, zero complaints about safe practices from psychologists with prescriptive authority helping the people of New Mexico as they've been doing here since 2003. You know, it's not unusual nowadays that non-physicians prescribe medication. Nurse practitioners prescribe, and they prescribed in New Mexico before psychologists. Physician's assistants prescribed also prior to prescriptive authority for psychologists. And they had general focus on their medical training and on for whom they would prescribe. There's a major difference for psychologists for prescriptive authority. The major difference is this. When it comes to psychotropic medication, it is not merely a certain condition, a certain disease. You know, it's not like an infection where the doctor prescribes antibiotics and then it's his drugs against your bugs. It's not like a cancer where the surgeon's scalpel or the chemotherapy is pitted against this neoplasm. This is a case where an understanding of the person and the personality and the condition of the person's mental health needs to be understood thoroughly. There is no one in the medical profession, apart from psychiatrists, who are actually trained to do that with the same thoroughness, diagnostically and empathetically, as psychologists. So the real point here is, who do you want to have a prescription pad in their hands when it comes to mental health? Somebody who understands the condition, who has diagnosed the condition, who works with the patients who have the condition, or somebody whose training has not given them that level of depth and understanding for the prescribing. So when it comes to how you experience the question of prescriptive authority for psychologists, you have to think, on what basis is a psychotropic medicine being prescribed? I personally have found, and our experience in New Mexico has validated, that a psychologist who understands mental health, who diagnoses the condition, who empathizes with the patient, who understands the biological dimensions of their condition, those psychologists are in the best position to be the ancillary practitioners with prescriptive authority to expand the world that psychiatrists first entered as a specialty.